Hello, my name is Roisin and I'm one of the nurses with the Irish Heart Foundation. In this short video, I'm going to talk to you about how to measure your blood pressure accurately at home using a home blood pressure monitoring device. You may be wondering what is the best device to use for measuring your blood pressure at home. If you go onto our website, irishheart.ie, and into our blood pressure section, you will find a link to a list of recommended devices that will be suitable for home use. There are devices that can measure your blood pressure using a cuff for your wrist or a cuff on your upper arm. Preferred devices for home use are those that measure blood pressure using a cuff on your upper arm. You can always consult your GP or your pharmacist for advice, and you can buy your home blood pressure monitor either online or in your local pharmacy. Home monitoring will help you to take control of your blood pressure and play an active role in managing your health. Now we look at how to check your blood pressure. Firstly, be sure to avoid caffeine, alcohol, strenuous activity and smoking for at least 30 minutes before you check your blood pressure. Try to relax and sit quietly for 5 minutes if you can. It's important that you sit upright in a comfortable position with your feet flat on the floor, and remember not to cross your feet or your ankles. Going to put your arm on a flat surface, like an armrest or a table, with your palm facing upwards. You can pop the blood pressure cuff onto your bare upper arm and ensure to close it snugly. The bottom of the cuff should sit just above the crease of the elbow. Make sure that the tube is at the front of your arm and pointing downwards. You then press the button on the machine and you'll feel the cuff start to inflate and tighten around your arm, and this is normal. The cuff will then deflate slowly, a little bit at a time. It is normal to feel some small pulsations as the cuff is deflating. Once the cuff has deflated fully, you will make a note of the numbers on the screen, and you write your blood pressure as the top number over the bottom number. You may see a third number at the bottom of the screen, and this is your pulse rate. Remember to note the date and the time that you took your blood pressure. It doesn't matter which arm you can use either, but just make a note of the arm that you used beside your blood pressure reading. And finally, how often should we check our blood pressure? A single reading is not usually enough to tell if your blood pressure is high, within the normal range, or low. So what we would recommend is that you do maybe 3 readings at a time and take the average. To get an even better picture of your blood pressure, it would be really useful to take blood pressure readings for 3 days, first thing in the morning and in the evening time. We'd advise you to do it before your breakfast and then maybe about 12 hours later.
A normal blood pressure is less than 120/70.
If you're on blood pressure medication, it's advisable to have it less than 130/80.
For most people, high blood pressure is 140/90.
This guideline may vary depending on whether you have a health condition or not, so it's important to discuss this with your GP. And remember, if you're taking blood pressure medication, don't stop taking it unless you're directed to do so by your doctor. For more information and advice, you can contact our nurse support line on 01 668 5001 or support@irishheart.ie. And you'll find lots of information and advice available on our website, irishheart.ie.